Good evening and welcome to the February edition of the Ask Mary and Pat Show. We're grateful that you've taken time to join us tonight as we continue our mission of keeping Mississippi families informed, empowered, and connected to the resources that matter most. We recognize the leadership of Oak Hill Regional Community Development Corporation, Dr. Michael O. Miner, Executive Director, Lottie Miner, Project Director, and Bert Taylor, Lead Navigator Project Administrator. You may learn more about all that we do at www.oakhillregionalcdc.com. You may connect with us at 662-298-3584 or connect at healthytogetherms.org.
This is Pat. This evening's discussion comes at a critical moment for parents, caregivers, and child care providers across our state. Mississippi families are navigating tighter SNAP eligibility checks, long child care voucher wait lists, and outgoing Medicaid and CHIP renewals, all while trying to keep children healthy, supported, and thriving. Our goal tonight is to break down these updates clearly, offer practical guidance, and highlight the community partners who stand ready to help, including our federally qualified health centers. As always, the Ask Mary and Pat Show is a space where we blend trusted information, real life questions, and faith rooted encouragement to help families make confident decisions. We invite you to stay engaged, take notes, and share this session with others who may benefit from these timely updates. You may type your questions and comments in the chat.
Okay, we're going to introduce ourselves at this time. My name is Mary Fenner, and I am a Medicaid application administrator, also a navigator with Oak Hill Regional Community Center.
And my name is Pat Boga. I'm also Medicaid Applications Administrator, Navigator Assister with Oak Hill Regional CDC.
Okay, now we're going to go into the February 2026 updates. Current status for the SNAP benefits are still being issued to eligible Mississippi households. However, federal proposals would shift a portion of SNAP benefits and administrative costs to states. If fully implemented, Mississippi could eventually be responsible for about 15% of SNAP benefits and up to 75% of administrative costs, tens of millions in new state obligations. So, what this means for the families in February 2026, benefits are still being issued, but eligibility checks are getting tighter. Sorry. Families should expect more detailed verification of income, assets, and household size at application and recertification. Keeping contact information updated and responding quickly to MDHS mail, text, and online notices is more important than ever.
Child care vouchers, wait list, and funding gap. Roughly 16,000 Mississippi families remain on a child care voucher wait list after the expiration of pandemic era federally funding that had temporarily expanded access. The legislature previously appropriated 15 million, okay, $15 million, less than half of what DHS requested, leaving a significant gap between need and available support. TRISHARE pilot and limits. Governor Reeves has promoted a $1 million TRISHARE child care model, employer, employee state. Advocates and experts Describe this as a small pilot relative to the scale of need, and note that it will not quickly clear the existing wait list or stabilize all struggling providers. Impact on families and providers. Parents risk losing jobs or cutting hours if they cannot afford care. Children face inconsistent learning environments, and providers are cutting staff or closing, which harms both family well-being and the state's economy.
Medicaid and CHIP in Mississippi, including dental. Mississippi Medicaid and CHIP cover doctor visits, hospital care, immunizations, and many preventive services for eligible children. Dental coverage remains mandatory in CHIPs and is included under the Medicaid's EPSDT benefits. Preventive checkups, cleanings, fluoride sealings, restorative fillings, crowns, emergency treatment, and medically necessary extractions. Dental coverage is mandatory in CHIP programs and includes preventive services, checkups, cleanings, fluoride sealings, restorative care, which is fillings, crowns, and emergency treatment. The frequency of dental visits. Most CHIP programs include Mississippi's allow 2 oral exams and 2 cleanings per year, plus fluoride treatments and sealants for permanent molars, along with x-rays and medically necessary extractions. Post-public health emergency unwinding. Many families have gone through renewal since continuous coverage ended. Some children and adults lost coverage because of missed paperwork or outdated contact information. Families should update addresses, phone numbers, and email with the Division of Medicaid. Open and respond to all mail and text from Medicaid and CHIP. If coverage is lost, check healthcare.gov for ACA marketplace options, including children may still qualify for Medicaid CHIP even if parents move to marketplace plans.
Okay. Federally qualified health centers in Mississippi. Role in 2026. Federally qualified health centers remain a critical safety net as families navigate through SNAP changes, childcare instability, and Medicaid and CHIP churn. They provide primary care, behavioral health, and often dental and pharmacy services, sliding fee scales for uninsured or uninsured patients, on-site help with Medicaid, CHIP, and marketplace enrollment. And some of the importance of federally qualified community health centers, they are often the most stable access point for care when coverage is in flux. They can connect families to food pantries, WIC, and local support programs, and they help families avoid delaying care when they are between jobs or waiting on coverage decisions.
Okay, now we have some questions and answers, February 2026. Okay, our first question is, are SNAP benefits secure for Mississippi families right now? Yes, SNAP benefits are still being issued to eligible Mississippi households. However, new federal rules and cost shifting proposals mean the state may have to cover a large share of benefits and administrative costs in the coming years. That's why MDHS is seeking more funding for stronger income and assets verification tools, and families should expect tighter eligibility checks and more paperwork at recertification.
There's another question. Why are so many families still waitlisted for child care vouchers? The answer to that is pandemic era federal funding that expanded vouchers has expired, and Mississippi has not replaced that level of support. About 16,000 families remain on a wait list, while the legislature's $15 million appropriation was less than half of what DHS requested to stabilize child care. Providers are struggling financially, and many centers risk closing without more sustained investment.
Okay, what is the state doing now to address the child care crisis? The legislators' earlier $15 million appropriation helped, but did not meet the full need. DHS has focused recent requests on SNAP administration and error rate reduction tools. Governor Reed's $1 million TRISHARE proposal is a small pilot that may help some families and employers, but advocates said it is far too limited to clear the wait list or fully stabilize the child care systems.
How does this affect working parents and children directly in 2026? Parents may lose jobs or reduce hours if they cannot secure affordable child care. Children may bounce between caregivers or stay in unstable settings, which disrupts learning and development. Providers are cutting staff or closing classrooms, which reduces available slots and slows Mississippi's economic growth by making it harder for parents to stay in the workforce.
Right. What can families do right now about child care? Families should stay in contact with DHS for voucher wait list updates. Explore community-based support, such as churches, nonprofits, family networks. All local providers about creative options. Ask local providers about creative options like sliding scales or volunteer for discount arrangements. Call or email legislators to share how child care costs and wait lists are affecting their ability to work and care for their children.
What about families who recently lost Medicaid coverage? Can they use the Affordable Care Act? Yes, families who lose Medicaid can check healthcare.gov if they have a qualifying life event. Most Mississippi families qualify for subsidies that lower premiums, though the end of the enhanced federal premium subsidies will still leave premiums unaffordable for many families. Children may still qualify for Medicaid or CHIP, even if the parents move to marketplace plans. So families should always ask about children's eligibility separately.
Okay, there's another question. Do Medicaid and CHIP still cover dental care for children in Mississippi? Yes. Dental coverage remains mandatory in CHIP and is part of Medicaid's EPSDT benefit. Children can receive preventive services, which are checkups, cleanings, fluoride, sealings, restorative care, which is fillings and crowns, and emergency treatment when medically necessary. Most CHIP programs allow 2 oral exams and 2 cleanings per year, plus 4 fluoride treatments and sealings for permanent molars.
Okay. What if families are worried about losing Medicaid CHIP coverage? Okay, they should keep their contact information updated with Medicaid CHIP agencies and respond quickly to their renewal notices. And states must provide notice before coverage ends. If a child loses coverage, families can explore ACA marketplace plans and ask the local federally qualified community health centers or community organizations for help with applications, appeals, or finding low-cost care while coverage is being resolved.
How can federally qualified health centers help Mississippi families right now? The FQHCs can provide primary care, behavioral health, and often dental services on a sliding fee scale. Help families apply for or renew Medicaid CHIP and marketplace coverage. Connect families to food assistance, WIC, and local support programs when SNAP or income is unstable. Encourage families to treat FQHCs as a home base for care and navigation, especially during this season of policy changes and financial stress. We also have some questions in the chat. The first question is, what happens if someone misses a SNAP renewal notice due to outdated contact information? When that happens, you need to contact DHS and give them your current information and see if you could set up an appointment to get your SNAP benefits renewed. There's another question. How long does it take for coverage to be reinstated after missed paperwork is submitted? Probably usually takes about 30 days for them to process an application. Sometimes it'll take sooner, but the longest amount of time would be 30 days. You might get it back renewed within a couple of weeks, but 30 days is the longest. We have a couple of more questions, Pat.
Okay. What documents should families gather now to prepare for tighter eligibility checks? Well, one of the main things is make sure that you get your income together for the previous month, all check stubs you've received, or if it's self-employment income, you have to get that together. And that's basically it, because if you already have a case open, they have your identification, your social security numbers, and all of that. But just make sure that you get all of your income statements for the previous month together, so you won't have to go through a long process trying to find it or get it.
Right. The income is what keeps a lot of people from getting renewed because they didn't submit their income. So that's the most important thing I'm sure that for tighter eligibility checks, it's going to be whether you submit your income.
Mm.
If a parent moves to an ACA marketplace, how can they ensure their child remains covered? Well, first of all, ACA will check to see if your child is eligible for Medicaid and will send you a notice letting you know, have you applied for Medicaid, or that you should apply for Medicaid because the children may still be eligible. So, and therefore you can check with Medicaid, put in an application for Medicaid, or if it's a renewal that needs to be done, renewal, and we can help you with that as well. You can contact our office and we can help you with submitting Medicaid applications and Medicaid renewals. Our number is 662-298-3584. And when they answer, just let them know that you want to apply for Medicaid or you have questions about Medicaid that you couldn't get answers from actually the Medicaid office. There's one more question, Pat.
Okay. Can families appeal a Medicaid or CHIP denial, and how? Now, I may need Mary's assistance with this, but one of the main things is there's a number that you can call. There's a toll-free number that you can call in at your, well, since it's Mississippi, in Jackson, and they will give you the information. Well, they'll get your information and go from there. And sometimes, they may even go ahead and let your child get the coverage until the decision is made. But I know that's one of the things that you will have to call that number, and or either just contact your local Medicaid office and just ask them for the contact information. But I
Right.
would get right on it because I believe there is a certain period of time you have to get that done.
Right. And the toll-free number is 800-421-2408. You can call that number if you want to file an appeal or let your local Medicaid office know that you wish to file an appeal. And you can always file an appeal. Also, another thing you can do is if you get denied, you can always reapply. You don't not, there's no waiting period. As soon as you get the denial, if things have changed or if you see that maybe you missing something in, then you can just reapply right away and put in a new application in order to get the Medicaid assistance that you need.
And another thing, don't hesitate to reapply. If you get denied, you know, some people say, I'm not going to reapply again because they denied me and they probably going to deny me again. Don't think of it that way.
Right.
Reapply anyway.
Especially if you know that you missed sending in something, or if something's changed, your household size has changed, your income has
Right.
changed, please send in another application. Like I said before, there's no waiting period. You do not have to wait so many days before you can submit another application. You can submit another one right away. You do not have to wait. I don't see any more questions in the chat.
Okay.
Okay.
There's another question on social media. How many check stubs will the family have to submit for income?
The checks, they will have to submit the previous month, the entire month for
Right.
whatever date that you apply. If you apply in March, you need to submit them the entire month of February. It has to be, if you get paid weekly, then you need to send in at least 4 checks.
Four.
If you get paid bi-weekly, at least 2, but it needs to cover, it needs to be consecutive, and it needs to cover that month, that particular month. Sometimes your pay period may run over into the current month, or it may have started in the month before February. So if that's the case, then you need to send in, you can look at your check dates. And if you have your check dates are for the 4 consecutive or 5 weeks in March, because February, it wouldn't be in February, but then you can send those check stubs in. Also, if you got paid 5 times in a month, they will not count all 5 checks. They're only going to count the 4 of those checks. In the same way, if you get paid bi-weekly and you so happen you might get paid 3 times in a month, they're only going to count just those 2 check stubs. So, but just you have to send in the check stubs for the prior month at which you are applying.
Any more?
There's one more question in the chat. What are the most common reasons family are losing Medicaid during renewals?
Hmm.
And we talked about that before. The what is two. One of them is you did not update your contact information. They sent it and it went to the wrong address. I mean,
Mhm.
it came back to them that you are no longer at that address. You immediately get cut off. There's no, if once the mail comes back to, and it'll go back to Jackson to the main Medicaid office, and then they will let the local offices know that this mail was returned. And if that's the case, you would get cut off. That's the main. And the number two reason is not
Right.
submitting income.
Mhm.
That is the number two is you do not submit your income timely. And they will send you a
Right.
notice letting you know that you have 2 weeks to send in your income. But if you go past that 2 weeks, there still
Right.
might they'll still be able to process it. So if whenever you get it, they have a fax number on the letter. You can fax it to their office, or you can take it to the office, or if their office is not close, because they have had some changes as far as some counties are no longer like Panola County office now is in Clarksdale, and that might be a bit far for you. You can contact us and we can try to get the information to the office for you.
And another reason, Mary, is their income may have increased for that month, and it
Yeah,
may be over the limit,
right.
but just reapply again.
Right. Yeah, because that's another reason that if your income is over the limit, maybe you got paid a little bit more because of overtime or you worked extra shifts or something like that for that particular month. And if that's the case, you can reapply, give them updated income information.
There's another question pertaining to that check stub question. It says, what if they work 2 weeks, miss 1 week, then work 2 more weeks out of 2 weeks due to the weather?
They would still need, even if you miss 2 weeks, and that's fine. You can let them know that I missed 2 weeks. So you have to, whatever you receive for that particular month, you have to turn that in. Now, one question they may ask, is this a common thing? And if not, they may request for you to send in additional income, like either like you work 2 weeks, you miss 2 weeks, and then you work 2 more weeks. They may want the income after those 2 weeks to see how your income is. So um, that's the way they'll do it. Because I know it has to be consecutive. And if that's all you worked in one particular month, then that's what they will use. But if there are changes, like if you get approved for Medicaid and then your income is changing, you need to let them know that your income has changed. Once a child gets approved for Medicaid, they're given 12 months, regardless of income, household change, it doesn't matter. They're still going to get those 12 months, but they still need to know if your income has changed. So your child won't be affected if your income has changed and you feel like, well, I'm making more money now, they're going to take my child off, but they will not. But when it comes time for the renewal, then they'll see the income change, and then that's when you might not be able to get Medicaid any longer. But you know,
Any other questions?
That was the last question I had on social media, and they thank you for answering those questions.
you're welcome.
Okay. Well, for our closing We just want to say thank you for spending your evening with us and for being part of a community that cares deeply about the well-being of Mississippi's children and families. Tonight's conversation reminded us that while policies and programs may shift, our commitment to supporting one another remains steady. Whether it's navigating SNAP changes, understanding Medicaid and CHIP benefits, or finding stable childcare, you are not alone. There are resources, advocates, and community partners ready to walk with you. We encourage you to stay connected, keep your information updated with state agencies, and reach out to your local federally qualified community health centers for help with coverage, care, and community support. Remember, informed families are empowered families. You may connect with us at 662-298-3584 or connect at healthytogetherms.org. We look forward to seeing you again at our next Ask Mary and Pat show. And that will be Monday, March the 23rd, 2026, 6:30 p.m. And until then, stay encouraged, stay connected, and continue to uplift one another as we work together to strengthen families across Mississippi.
Also, you can go to our website, Healthy Together Mississippi, like us, follow us, and you will continue to receive information dealing with Medicaid, CHIP. We have other programs as well that you may be interested in knowing more information about.